Hi guys, it's Nicole Jones from the Physio Crew, and you come through to this because you're looking and Googling headache. And so there's lots of different types of headaches that we treat in physiotherapy clinic. If you've come onto this by mistake because you are looking for why you might have a headache, if you've got a severe headache, then call 111, the NHS service line, and then they can give you some advice on the appropriate treatment. They can ask all the relevant questions. The kind of things that we're a little bit more concerned at is if you're having any problems with your speech or your swallowing, if you were to have weakness in your arm, or whether someone was to notice a drop in your face. Some severe headaches can be stroke, so make sure that you're, if you think that you're getting any of those symptoms, have a little look at our FAST video, and that will give you some clue as to whether you could be having a stroke. But most headaches are not associated with sinister pathology. Unfortunately, our muscles can get tight. That can give us severe headaches. We can get hormonal headaches. We can get problems with the back of our neck that cause headaches. So some of them are able to be treated with physiotherapy and acupuncture, and some are more doctor related. So if you're very, very concerned that it might be something serious, call the NHS 111, or if you think you're having a stroke, then you call 999. But this video is for information purposes only, and it's focused more on the type of headaches that people are getting from a musculoskeletal source. So that might be at the top of the neck where there's stiffness in the joints. It might be that you have been experiencing a little bit of headache if you've been working at a computer for long periods of time. And those sort of headaches that are associated with the neck, they tend to radiate. They sort of sit at the back here, they radiate up over the top of the head and then sit behind the eye. Sometimes you can even reproduce the headache if you put a little bit of pressure on the area. This can actually recreate the headache going up into the head, and that gives us a good idea that this is referred pain. If we can touch here and then it refers up into the neck and the head, then that gives us an idea that it's something that physio would be able to help. So on an assessment, when we're looking at that, we'll ask you a series of questions to make sure that there's no kind of sinister pathology. Physiotherapists are autonomous practitioners, which means you don't need a GP referral to come and see us. We are trained so that if it was anything untoward, we'd be able to refer you back, and we just send you with a nice detailed letter so the doctor knows exactly what we found on our assessment. We're a bit luckier than doctors. We get our 45 minutes to really assess you properly, and which is hard for them. They've got 10 minutes. I wouldn't be a GP. It's like the hardest job in the world. But we get a nice lot of time to be able to assess you thoroughly. And then if it's a musculoskeletal cause, so if it's to do with the ligaments or the bones or the joints or the soft tissue, then we'll apply treatment in that first session as well to try and help you. So the sort of treatments that some people find beneficial, it depends on what the problem is. If it's a myofascial problem, if it's to do with a muscle, then soft tissue release can be really good. We can use ultrasound, we can use TENS, we can use joint mobilizations, we use heat, so wrapped in a tea towel, a hot water bottle wrapped in a tea towel, applied to the area for 20 minutes can be beneficial. But again, we need to make sure we understand the source of the problem and make sure that the headache is coming from here. You wouldn't apply heat to the head, guys. It would only be, although you feel the headache at the back and here, sometimes it's actually coming from there. So those are the type of things that you probably need to see a physio to understand where you should be applying the heat, what you should be doing, what's okay to do, and especially because some of the headaches can be from the C2, C3, which are the top cervical areas, and so we would be looking at whether we need to adjust your position, whether we need to put your computer up on an aid, on sort of like a laptop aid, or whether we need to bring the mouse closer. So there's lots of little tips and tricks to help to reduce headaches, to improve your posture so that you're not down in a pokey chin type posture. And yeah, I hope that's been helpful. So if you do have a headache, if you, like I said before, if it's an emergency, then make sure that you call 999. If you're not sure, then call 111. But physiotherapy can be a really, really good tool to help you manage your headache. All right then, take care guys, bye bye.